India is on high alert after the death toll in the deadly coronavirus has risen to 80 in China and is also spreading to other parts of the world. A suspected patient of the virus has been admitted in Jaipur's SMS Hospital. The boy is a medical student in China. India is also at this point examining all options to provide relief to nearly 250 Indians who are stuck in Wuhan, which is the epicenter of the fast-spreading coronavirus. The Ministry of External Affairs said it is in touch with the Chinese government and is exploring all options to provide relief to Indians who are stranded in Wuhan. Chinese officials at this point have confirmed that the virus is infectious in the incubation period itself. That's even before the symptoms actually show up. There is no cure yet for the deadly virus. Coronavirus has at this point spread to 12 countries, with Canada being the latest to report a confirmed case. There are now 5 confirmed cases of the coronavirus in the United States. Devankur is joining us live with more details on the story. Dev, good morning. Any confirmation that's come in at this point from the authorities who are treating that student at Jaipur's SMS Hospital on whether he's confirmed to be the first case of coronavirus in India?
Well, good morning, Akshita. So far, the status is that that person has been kept in an isolated bay. It is a quarantine bay where he has been kept, and his samples have been sent for further testing. Although the symptoms that he had shown of fever, of dry cough, of lethargy, and other symptoms that are there are the ones which generally happen when someone when the coronavirus has been transmitted into someone's body. But so far, the results of the tests that have happened have not come out. But clearly, the authorities are not taking any chances whatsoever at this stage, and that person is being kept completely away from all the other patients at the hospital.
Okay, Dave, just stay on with us. We are also reaching out to some medical professionals to get you a sense of how you can perhaps also be alert for any of the signs, the symptoms, particularly for people who've recently traveled to China. Dr. K.K. Agarwal, former president of the Indian Medical Association, is with us on this broadcast. Dr. Agarwal, good morning and thank you for speaking to us here on India Today. Considering the coronavirus outbreak in so many parts of the world, there is also a high alert here in India. What would be your advice, doctor, to anyone who's traveled recently to China? What are the symptoms they should be looking out for?
See, anybody who has recently traveled to the China affected area, and if he has cough with fever, he should immediately report to the health authorities. He needs to quarantine himself for 14 days and testing needs to be done. But one good thing is that the virus till now has gone to 14 countries, but not till that people who are traveling outside China have upper respiratory tract infection, which is less infectious, and those who have lower respiratory tract infection, which is more highly contagious, are the people who probably will not get a space in the travel because they will be needing an ICU admission or they will be having a productive cough. So anybody having a fever with a non-productive cough probably has a upper respiratory infection. They may not transmit human-to-human infection to others. So that is the reason that why human-to-human transmission has not been seen outside China.
So, Dr. Agarwal, I want to stress on that point that you just made. So, you're saying that while it's been person to person, the transmission of the virus within China, outside China, that hasn't been confirmed. And secondly, when officials say that the virus is now infectious in its incubation period, what really does that mean?
That it means is, see, again, when you have an infection, it can be upper respiratory infection or a lower respiratory infection. Now, in the incubation period means the incubation period is 7 to 8 days.
Okay.
During these 7 to 8 days, if you are having coughing, see, you will not be able to transmit it without a cough. It is unlikely because this is a droplet infection. Asymptomatic public would mean is fever. You may not have fever, but if you have cough, and if that unless you cough, the droplet will not come out of the body. It is not like that you are absolutely asymptomatic, no cough, and you are transmitting infection. Unlikely. So those people who are having cough, if they are 3 feet away from you, you have no risk of getting the infection.
Okay. Dr. Agarwal, I appreciate you taking time out to speak to us, sir, and kind of give us a sense of what are the signs to watch out for people who've travelled to China, particularly the areas where, this coronavirus outbreak has been confirmed, to ensure that even if you have a slight sign of discomfort, of cough, or even of a cold, what would seem like normal, a viral fever symptoms, even those must be taken seriously, and you must go for a checkup to a nearby hospital. Now, as the death toll due to the coronavirus has touched 80 in China, President Xi Jinping has ordered faster response, sending teams into several affected areas to really push local officials to not just strengthen prevention, but also, very importantly, contain the virus outbreak.
The deadly coronavirus is spreading rapidly and China is battling to contain it. China has banned the shipping and sale of wild animals and said it's sealing breeding sites. Trade is forbidden in markets, restaurants and online. It also warned people against consuming wild animals. And Beijing is scrambling to build infrastructure to cope with the rising number of cases. A 1,300-bed hospital is being built in Wuhan in 15 days. Another 1,000-bed hospital will be completed in 6 days. China has announced a partial lockdown in the southern city of Shantou to contain the deadly virus. After Tianjin and Beijing, another major Chinese city, Xi'an, has suspended long-distance buses and tourist chartered buses. Chinese President Xi Jinping admitted that the situation was grave as the death toll rose steeply. The Chinese Communist Party has set up a committee to oversee relief. Hong Kong has declared an emergency and closed schools for the next 2 weeks. The virus has now spread to South Korea, Japan, Thailand, United States, Singapore, Vietnam, Hong Kong, France, Nepal. Australia and Malaysia have also reported the coronavirus cases. In India, the Prime Minister's office reviewed preparedness to deal with any situation that arises. The government was constantly checking on the well-being of Indians in China. Bureau Report, India Today.